Good afternoon, everyone. Welcome to this July meeting of the Health and Wellbeing Board in Derby. Thank you for coming along. Do we have any apologies, Lindsay? I've got Councillor Hazelgrave.
Yes, we have other apologies from Councillor Wright, Councillor Ashby, Emma Aldred, Jim Austin, Chris Clayton, but Chris Vina is covering, Sam Dennis, Kim Harper, Dean Howes, Sue Ann Lim, Kathy McLean, Jane Needham, Mark Powell, Louise Braham to cover, Doug Walkman, Michelle Skinner, Karen Swan to cover. That's it.
Thank you very much. Thank you. We don't have any late items. We do actually have an addition to the agenda, though. Margaret and I set the agenda with Alison, of course, and we were happy with the length of the agenda because we're trying to have fewer items, especially when they're so substantial, and not have any pressure on the time in the meetings. However, we needed to add a policy update for the 10-year health plan for England, and the ICB, we're going to present on that for Nikki Doherty. Unfortunately, she can't be here. Is that correct? Has she sent apologies? So she can't be here either. So what I'm going to do is I'm going to, it is a kind of late addition to our original agenda. So I'm going to let Robin Dewar speak on it for a little bit so that we can have an initial discussion on it. So quite a few people in the room have already looked at this at some length, but we will obviously need to bring it back for a fuller discussion another time. Thanks. Do we have any declarations of interest? No, thank you. Minutes of the meeting on the 8th of May. Are we all happy with those minutes? As a true record, any matters arising? No, thank you very much. So in relation to the Health and Wellbeing Action Log, I've just had a look at it earlier. Some of the items are completed, some are in progress. One was due for a sort of update today, but Robin Dewar has been in contact with me about that and is going to, it was Councillor Hazelgrave who specifically raised this issue about gambling. And you're working on that, aren't you, Robin? You've got that in hand. So I'm happy with that. The issue about vitamin D, we haven't had any response from the regional team. I'd ask that we look at trying to get a response or look at that again, Alison, perhaps Robin, if you could think about a way we can get a response to that query. And then we've got the other item in progress is due back on January the 26th. So is everybody happy with that? Yeah, thanks very much then. And right, well, I'm really pleased to be able to move on very quickly and actually on time to the first substantive item we've got, which is Robin Dewar's Director of Public Health in Derby, her annual report on climate action, the benefits for our health. Thank you.
Thank you. And just before I start, I just want to say this has been a great piece of work by the team. Just want to thank the team members that have contributed to this, but also to the children and young people in the city. So as you see, their artwork is present throughout the report as well. And they also engage with us in some focus groups. So as we go through, you'll be able to see that. But I do want to thank them specifically for their contributions. So next slide, thank you. So for those of you who aren't aware, the Director of Public Health annual report is a statutory function for the Director of Public Health. We must write an independent annual report and it must be published. And it can be on any topic that we choose. It's entirely at our discretion as to where we want to focus. And this year we have specifically chosen to focus on climate change. As an ability really to focus and to highlight this as an issue. And importantly, just as a theme as it goes through, this is around the co-benefits. So it's the positive actions that we can all take which will support us individually and our health and our well-being, but also have an impact on the climate. reduce our impact on climate change. So, and just to say for the artwork, as you go through, some of the young people, children and young people, have added comments and explanations around their artwork, which is also a joy to look at. So thank you. Next slide. So what we're particularly covering in the report is the impact of climate change on health, and focusing on 8 key topic areas. So thinking about clean air and transport, food systems, homes and buildings, green and blue spaces, education, jobs, health and social care, and social capital. So thinking about the co-benefits, the things that we can do that benefit our own health as well as the climate within those categories. And as well as some of the background research and evidence review that was undertaken, the views of young people on climate and health were gathered through 3 focus groups. This was through the schools in the city, and 33 young people engaged with those. They were between the age of 11 and 18. And as I mentioned before, their fantastic artwork. Over 200 children entered our art competition. Councillor Martin, we had great joy in judging that artwork as well. It was fantastic to see all of the work that was done, some fantastic thoughts as well from the young people. And I think it's really important to include the views of young people in this report. As we go through, I think there's a theme generally around health inequalities, and what we have to remember is that climate change is going to have a disproportionate impact on our young people. As the climate changes, they will be affected the greatest. And so it's really important to consider their thoughts and views and concerns in this. Thank you. So we thought about direct impacts and indirect impacts. So the direct impacts are often much easier for us to think about, thinking about the actual temperature, air pollution, infectious diseases. We've seen some occurrence of mosquito-borne infectious diseases spreading across Europe, and also extreme weather. That's easy for us, I think, to conceptualise. But there's also the indirect impacts from climate change, so around people's work and jobs, use of land, as we've seen with farmers recently, but the prices of food, prices of water and of energy also significantly impacted by climate change. So it's a breadth of impact across our wider areas of our health. And as I mentioned, young people particularly, but also older adults, those with existing medical conditions, and those in most deprived communities are the most affected, most likely to be affected for various different reasons, whether it be young people are more likely to be affected later on in life because we can see the trends in climate change, or whether we're thinking about our more deprived communities who perhaps have less resources and resilience in order to deal with some of those changes in the climate. Thanks. So there's really strong evidence around the impact of air pollution and its link to various conditions, lung cancer, cardiovascular disease, and respiratory disease, things that we can really logically connect together. But we've also got a growing body of evidence around air pollution and these other areas, low birth weight, diabetes, and cognitive problems such as dementia. So there's a growing evidence now that poor air quality is contributing to these issues too. And although air pollution affects everybody, as mentioned, there's some people who are much more vulnerable. So children, people with pre-existing health conditions, older people, deprived communities, and pregnant women considerably more at risk. So when we think about the co-benefits in relation to air quality, moving our travel towards active travel, that has the benefit of both reducing the release of air pollution and greenhouse gases, but also increasing our physical activity, helping to reduce levels of obesity and cardiovascular disease through that physical activity as well. And also important to mention the improvement in mental health through that physical activity. So we can think as individuals of our benefits around this, but also about the benefits to the climate. So when we think about our food systems, globally it's the second largest source of carbon emissions after energy, and that was really surprising to me when we sourced that information. And in the UK, it's around 19% of our domestic greenhouse gas emissions. And I don't think we consider that when we're buying or eating or choosing our foods. So there's things that we can think about when we think about our food systems that are going to benefit both us and the environment. So the first one there is reducing animal products, thinking about whether we can reduce the amount of meat and dairy products that we're eating, not necessarily to cut them out entirely, but is there an ability to reduce those levels and to use some sorts of replacement for them. Reducing the intensive livestock farming, which links very much to our demand for animal products, but also thinking about those farming techniques. Trying to eat locally sourced seasonal fruit and vegetables as much as possible, thinking about what we're buying at which time of year, where it's been grown, how far it's travelled to get to us, and if possible, growing our own as well is also part of that. And then reducing our food waste. We know that a huge amount of our food we waste either individually or collectively. And obviously that's a financial issue for us if we're buying that food and wasting it, but also it's the greenhouse gases that are emitted in the production and the transportation of that food in order to get to us. So what can we do to think about reducing that food waste as much as possible? When we think about our homes and our buildings, our residential buildings use 1/4 of all energy use and 1/5 of all greenhouse gas emissions come from our homes. And most of that is around heating, cooling and running our appliances. Alongside that, we know that we have significantly high proportions of households experiencing fuel poverty. That's higher than the East Midlands and the England averages. So people are struggling alongside this to heat their homes, and we know that well-insulated homes reduce carbon emissions, they're cheaper to heat, and they're better for our health. And just on the right-hand side there, we've got some impacts around cold homes on our health. So we can often really connect that to respiratory disease, but it also links to poor mental health, reduced school attendance, increase in symptoms around arthritis and cardiovascular morbidity as well, all linked into those cold homes. So green and blue space is incredibly positive for us, and that impact of our environment is really, really important to us. They're there as a carbon storage, helping to improve air quality, providing us with shade and cool areas during the heat, and also impacted on the risk and the severity of flooding. And our use of those spaces is an ability for us to be physically active, but we also know how positive green spaces can be for our mental health and well-being as well. So use of our parks, use of some of that informal street greenery as well that we've seen much more developing over recent years. And we know that being out in those green and blue spaces can help us to connect more with people, to develop more social aspects of our lives, and to decrease the risk of some of those mental health issues as well, depression, anxiety. And we know that it's good for children from a perspective of emotional well-being and from their resilience perspective as well. And just to mention that physical activity is really key for us as well in our general physical health and in our weight as well. And it's really important to increase our physical activity to improve our cardiovascular health, but also to reduce our risk of obesity. So green education is really, really key, and you'll see some themes through here from the children and their reflections on green education as well as we come to the end. But it's really important that we build that understanding of impacts on the environment, encourages all in the behaviours that we can take up that can protect the environment and reduce carbon emissions. So as part of the climate and sustainability strategy, all schools have been tasked with implementing their own climate action plans by the end of this year. And there's also an Eco Schools programme, which is encouraging recycling, litter reduction, composting, biodiversity, all of those areas. And many of you who've got children at schools will have seen some of the activity that children are taking part in at school, with building bug hotels and looking at recycling and composting as well within the schools. So 59 of our local schools are registered with the National Eco Schools programme, and 6 of them have achieved the Eco Schools Green Flag accreditation as well, which is a great achievement. And this is particularly important to us because it's around embedding the knowledge and the behaviours within our young people to understand what they need to do to have an active life, to promote their own health, but also thinking about what they can do to support the population and everybody around them by reducing pollution. So when we think about green jobs, the government's 2020 net zero strategy discusses green jobs as being crucial for the UK to reach the net zero targets. So part of what we need to do is not only think about our individual activities, but what can be done to ensure that there's economic development and opportunities through green jobs. So across Derby and Derbyshire, the percentage of businesses generating a proportion of their turnover from green goods and services has been increasing. And last year there was an increase in the investment in decarbonisation by businesses as well. So there are definitely positive signs around the developments. And these green jobs in the UK, they're generally higher quality, better paid and more fulfilling than non-green jobs. But there is a chance that they may have longer working hours, and also at the moment with the developments be a bit less secure, I imagine that will be a thing that will change over time. So there are some tensions or contrasts around those green jobs, but I think some real positivity in the increase in engagement of businesses with those. And we know that green jobs can bolster the local economy as well, and are really important to us from that perspective. So when we think about health and social care, we know that the NHS accounts for around 4% of England's carbon emissions. And in 2020, the NHS was the world's first health service to commit to reaching net zero across their direct and their indirect emissions. And there is a national programme of green plans for the NHS, and Derby and Derbyshire ICB are currently refreshing their green plan. We've also been looking at social care assets, and I think this is important, particularly from the vulnerability of the people living in or using those facilities, as they are potentially exposed to flooding or to extreme temperatures, and the people that are using those facilities are much more vulnerable to those conditions, particularly around extreme temperatures. And we know that all health and social care services produce some carbon emissions, so as a general theme, the less we need to use those services, the better that can be at preventing our ill health, but also that can help to reduce carbon emissions as well. So social capital is referring to networks, norms, trust that exist within and between communities. And we know that the connections within communities support us to make change, particularly in our behaviour. And in those communities where there's found a high level of social capital, we know that people are much more likely to be able to work together to reduce carbon emissions and adopt sustainable practices. And I think this goes along with as well having those social networks to reduce isolation and to improve mental health as well. So evidence is suggesting that social capital can enhance the effectiveness of climate adaptation strategies. So people working together can share information, share resources, but also understand between them what they can do to change. And is also associated with an increased public acceptance of climate adaptation measures. We know that social capital is providing emotional support, supporting with healthy behaviours, reducing the risk of mental health issues, and we know that communities who have strong social ties tend to have lower mortality rates and better overall health, despite the other factors that impact on that community. So we know this is a really key resource within communities to support health and also actions to reduce carbon emissions as well. So we had 3 focus groups on health and climate change with the 33 young people. This is some of the notes that were taken during those sessions, but Thank you. So when we have a look at the views, I think these views are really, really important, and I think they chime really nicely with the evidence that we found, and really important to consider what young people are thinking and what is concerning them around the climate. So this first question was, what do you think climate change will look like for Derby? So that first point there, environmental degradation and climate change. So the young people had really deep concerns about degradation and climate change, pollution, infrastructure deterioration, and a change in the ecosystems and extreme weather. So they were well aware of those issues and risks. Around air pollution and carbon emissions, they recognised that a lot of activities, public transport, personal vehicles, all of those were contributing towards the CO2 levels. From an economic and social impact perspective, they were talking about the changes in job markets, changes in local economies, increases in demand for healthcare, and the growing issue particularly of poverty and food insecurity. For technology and industrial shifts, there was a lot of awareness of thinking about the transition to renewable energy, increased use of solar, wind, alternative fuels, and the contribution that they can make to reducing emissions. And they were also acknowledging that some changes in that infrastructure, particularly that we're talking about public transport, but some changes in that infrastructure will be needed to support changes. These are not things that we can necessarily do individually, all of them, that we need support in the structures around us. And lifestyle and resource management, they were really aware of the impact of climate change on daily life, and I think that's particularly impacted over the last couple of years as all, hasn't it, in as seeing what's happening with the climate. And discussing issues around food availability, increasing in prices, migration and population shifts, and social and cultural shifts as well. So the next question was, what could we do to avoid climate change? And again, lots of suggestions from the young people. Sustainable practices and lifestyle changes, so really important, and they recognise the importance of thinking what we can all do to change our habits, recycling, waste management, thinking about transport, changing what we're eating, and reusing, recycling, repurposing our resources, which fits really nicely into the areas that we have been looking at. From a renewable energy and technological innovations perspective, students were discussing the widespread adoption of renewable energy, electric and sustainable transportation, and reducing industrial emissions. And for policy and community action, that acknowledgement that strong policies and community engagement are a key role. This is not just about us as an individual. And also that importance which links into the social connections around grassroots organisations and what they can do within their schools as well. So the next question, what is Derby doing well in reducing the impact on the climate? So they were recognising the increased use of public transport and walking, the expanding of the availability of electric vehicle charging, the recycling programmes and flood defences. When they were thinking about renewable energy, thinking about the hydroelectric power from the river, that was noted as a key step. But also the promotion of clean energy, encouraging local food production, and community-driven initiatives to promote climate action. And then that final part of that question, community engagement. So they were acknowledging that active community involvement is vital for a sustainable future, especially in relation to the green spaces and the grassroots environmental projects as well. And I think as we go through these, it's just incredibly encouraging that the young people are so aligned with the evidence that we've managed to find as well in this area. Thanks. So the next one, what stops people from taking action against climate change? So I think there was a real acknowledgement that there are some issues around awareness, but also belief in climate change. But there's also potentially insufficient education or conversations about climate change, feeling a feeling of powerlessness, almost, of insignificance in such a huge problem. How can I make a difference? From a personal and social perspective, an acknowledgement that our behaviours are embedded, and to change that is challenging and difficult for individuals to do. And there was also a discussion around whether people were well motivated, perhaps, or too busy, or there's a general peer pressure or influence on us around these issues and taking change. And then thinking about the economic and structural challenges, there was a real focus on the potential cost of making these changes and alternatives, which is a real barrier and challenge to some people. Thinking about the cost of electric vehicles at the moment and of installing solar panels, and how that's going to be a barrier for some individuals who may want to take those options. There was also consideration that government and local authorities could provide more visible actions or incentives to encourage sustainable choices. So what would you like to see happen at school about climate change? So they're really keen to see an increase in climate change education, particularly around recycling, global warming, increased integration of climate change discussions into their school lives, and lots of suggestions around activities that they could do within schools to promote that. Supporting the introduction of more recycling bins, composting systems, taking these actions much easier for people. Thinking about nature-friendly spaces, energy-saving measures, and investing in renewable energy. And then finally, under that question, recognising that together they were very, very powerful, and they could strive to make change. And so they were suggesting various activities such as fundraising for tree planting and other environmental projects, and using their voice to encourage active participation in school and within the community in sustainability initiatives. And then we've got a question for them which relates to the annual report, but is also a wider question. What do you think health is? And it's really interesting, I think, to see their responses. So one about physical health and lifestyle choices, where they were really recognising regular exercise, balanced diet, hygiene, preventative medical care, all of those things that we can do to have a strong physical health. But they're also noting mental health and emotional well-being, how they manage their stress and emotions, the challenges that they have, and thinking about sleep, relaxation, and social relationships, a really good understanding about what might be impacting on their mental health and how to protect that. So when they're thinking about holistic and preventative health, there was a focus on healthy lifestyle, balancing that physical and mental well-being, but also the importance of being able to access support, be it healthcare, being therapy, and that support to also take up active lifestyles. And then from a community environmental perspective, they were acknowledging the importance of friendships, social support, living conditions, things happening in schools, that raft of factors that impact on them and their health, which is really encouraging to see their really broad understanding of health and what impacts on them. So do you think climate change can impact on health? Absolutely recognise that there's an impact on the physical health, particularly around respiratory disease and heat-related disease, and skin cancer being the areas that were particularly focused on. But they also noted the experience that climate can have on anxiety and impacts on psychological health generally. Thinking about food, water and disease, they noted the impact on crop failures and food shortages, malnutrition, flooding. They had a really good grasp of the breadth of the impact on their health. And thinking particularly about vulnerable populations, they agreed with such older groups as older people, people living with low incomes, people with pre-existing health conditions. They could really see their vulnerability and considered how climate change and the impact on those individuals' health would then cause a strain on other services, particularly on healthcare, if it wasn't tackled. So we have a number of recommendations in the report, and these recommendations have been developed through colleagues within the council and also broader recommendations. There's a lot of recommendations here for us as a council, but what I wanted to do was pick out those that particularly relate to us and to system partners together so that we could have a conversation about those. As I said, that all of the recommendations are there, but if I pick out number 4 there, Derby City Council and system partners to consider health co-benefits as an alternative way of resonating with stakeholders on climate change issues. So helping people to see the immediate benefits to them from taking some of these actions, as well as the broader impact on the climate. Next slide, please. So there we have number 8, Derby City Council and system partners to implement the active travel strategy and plan to encourage and support creating behaviours, behaviour change, and influencing and delivering quality, inclusive infrastructure for day-to-day activity. And then number 9 specifically relates to the City Council and schools to encourage and educate children, teaching staff, parents and residents of the benefits of moving more and actively travelling. So there's a specific mention there of the work around school safe havens, but there's much more that we could all be doing to encourage active travel. No, sorry. Number 10 specifically relates to the Healthy Weight Declaration that the Council and a number of partners have signed. So exploring the use of Sustainable Food Places Award, working in partnership. And that's very much around ensuring that sustainability of food. The final one there, number 11, council and system partners to take steps to reduce carbon impact and food waste of their food offer. Thanks. Number 13, council and system partners to support residents to access retrofitting schemes to improve energy efficiency and quality. So this may be about supporting individuals to access it. It may be signposting people towards these services or signposting people towards this as an available option. Council and city partners to continue to protect and invest in the city's green and blue spaces with a focus on those areas which have less green and blue space and where this can provide adaptation against heat and flooding and increase opportunities for outdoor activity and active travel. And just on that, just to think about any potential spaces that partners may have that they may wish to do something different with. And the next slide. So we do have a recommendation for East Midlands Combined County Authority there around green skills and jobs as part of its regional skills and employment planning. Number 18, health partners and wider system to support the review of the Joined Up Care Derbyshire Green Plan to maximise impact, including co-benefits. So it'd be great to hear any thoughts around the Joined Up Care Derbyshire Green Plan development or the redevelopment. Derby City Council and system partners to explore opportunities to reduce the climate impact of social care projects and to take co-benefits into consideration. And number 20, Derby City Council and system partners to bring together community partners to share learning on climate, health inequalities and climate justice. And 21, Derby City Council and system partners to create opportunities for participation in collective action. So thinking about community gardens, rewilding, etc. And that links in also to that use of assets and space that people may have. Thank you.
Right, thank you, Robin. That is a really comprehensive report. I think it's a really, personally, my view is that it's a fantastic report. I think it's a foundational report really for the council. I think it should be, we should ensure this happens, produced and delivered and read at various levels across the council, including in the cabinet, of course. And I think, just the level of work that's gone into this is evidenced by the references, pages and pages and pages references that you have. It's a really well-researched piece of work in the document itself, obviously, and it sort of seems to set a kind of blueprint really for how the city might be in the future as an environment to live in, and how to make that healthier for everybody, as well as making the environment healthier. So as you say, there are these co-benefits, and I think that for me is the key word in this report. So I think it's that's my own view. Sorry to be very non-neutral as chair, but I think this is a really excellent report, and thank you for delivering it. I'm aware that Nikki has been able to join us. Thank you, Nikki, welcome. So we are going to take the full item on the 10-year health plan in a minute. So I'm going to revert now to the timings as agreed on the agenda. But we still have lots of time for questions and comments to Robin. Thank you. Paul.
Yeah, thanks, Robin. There's a lot there. In terms of the food, naturally, I've obviously got a vested interest in terms of working around that, and around the sustainable food. We are actually registered as a city with the Sustainable Food Network, but it's been a real struggle to coordinate a response, and technically I'm down as the lead, and probably other than a free night in London and a conference, it's been difficult to get things a bit off the ground, and I'm very conscious. I think we've cracked coordination in terms of dealing with ambient food. Surplus food as a city has been a great frustration of mine for a long time, especially food that goes out the city for people then to pay to come back in the city. It seems very illogical, and that, so I'd be happy to kind of have a conversation about that, because we've tried a few funding bids to try and get a paid role, because I think this is what it needs around the food waste trust, and for us as a city to have a surplus food strategy, which we currently don't have. I think would be an important thing, and something I've been talking about. But I think amongst all the pressures everybody has, it's been a bit of a struggle on that one. So it'd be really good to kind of look at that. And I think on the slide about the impact on people's health in terms of homes, I think it's important to add in there actually the impact around their basic welfare needs, because actually around clothing, around food, you know, when you're cold, usually you're more hungry, you need more clothing. You know, all that, you don't necessarily able to afford hot water to have a shower in. I think it's also to add into that the impact for people on low income that all those basic welfare things can have as well because of your house. And I know, you know, naturally, having been to the asthma steering group a few times and raised there about people in poverty and actually the impact and the increase in that, I think it's really important. But yeah, great report, and anything can do to help, especially around the food, I'm happy to do.
Thank you, Paul. Do you want to come back on that, Robin, or do you want to come back after a few comments?
Just really welcome that, yes, and we can pick that up, can't we? Yeah.
Thanks, Paul. I know we talked about this food sustainability issue and the need for some funding and personnel or a systematic approach. And I don't know, hopefully this report could be a launch pad for that. Thank you. Andy.
Yeah, thanks, Chair. I mean, like yourself, Councillor Martin, I think it's a really powerful and compelling report, Robin, and I think the report from the DPH just gets better each year. I mean, the report on gambling last year was incredibly strong and powerful. I think you've just surpassed yourself, and I think it's an absolute team effort. And I suppose just on the gambling report from last year, it was also good to see in the back of the report that there was a, you know, we said, we've done summary of the recommendations from last year, which is really good. And it feels really relevant. I know we keep talking about climate change, but it just feels as if it's the right report for the right time, really, in our kind of evolution as a city as we kind of move forward. I think the contributions, I'm going to cough. The contribution from young people is really powerful. I think both in terms of the task and finish groups, the workshops you did, the artwork's fantastic, and it was great to see throughout the report, you know, there who won and who was commended and everything. But actually, it was a really powerful artwork as well from a cross-section of different ages and so on. And I think the young people have absolutely nailed it in terms of the issues and their level of insight. You know, should make us all sit up and reflect as adults, as it often does when you kind of, you know, talk to kids about things that we talk about a lot in this space. I was interested in a few things, really. I think the recommendations are ambitious but are right. So there is something about how we position that going forward. And there's a few things for me, really. There's something about what is our overall comms kind of strategy going to be in this space, both across the system but also with the public, because there's some really kind of key messages in here, and there is an opportunity, isn't there, for us to kind of, get some of those key messages out, but also, that approach around helping people see the immediate benefits of taking action that could help in the immediacy and help them in the immediacy and their families in the immediacy, as well as the longer term implications and impact on climate change. I think is a really good focus here, because it just brings it back to what I can do and what it means for me as a person and as a member of the community. So we shouldn't lose sight of that. So there is something about, what's the common strategy around that. I think we need to reflect on how we position some of this within the partnership with MCA, and it's good to see some recommendations there that sit in that kind of combined authority space, as well as, there's still a lot more to be doing with our schools, and it's, fantastic that we've got, 59 schools that are absolutely involved in a much more kind of targeted programme, but there is definitely room for improvement there, isn't there? And I just think that the messages from the young people here are just shouting out that we need to probably have a much wider reach across schools, and there's something about how we get those messages out to the primary strategy group, the secondary strategy group, the work that Derby Promise is doing, which was kind of writ large in the report. We need to be building on that, don't we, and getting the momentum going. And the final point really was around the kind of messages for the major anchor institutions in the city. Because we've got a Joined Up Care Derbyshire Integrated Care System Anchor Institution Group. I'm one of the leads on that, along with Chris Clayton from the ICB. So obviously one of the priorities for anchor institutions is around green and sustainable climate change. And so I just wonder, how do we take some of those messages and put that in the anchor space? Because the anchor institutions group is, kind of like no other really. When you've got, all the key anchors, so we've got all the health components, you've got the two local authorities, both Derby and the county council, but you've also got some of the key businesses in the room, like the university and so on. And I just wonder if some of those recommendations need to be routed through that group as well, so we can kind of join it up a bit, so it doesn't become a kind of siloed conversation. But I think empirically it has real significance, and I agree with you, Alistair, we need to be kind of, absolutely building on this going forward. But a fantastic job, Robin and the team as well.
Thanks, Andy, yes. Did you want to comment on that, Robin, or...?
No, just thank you, and yes, we can have a look at those points. Yeah.
I just before I bring you in, there's just a very quick comment from me to follow on directly from Andy's. I think that's absolutely right, Andy, and it's about, because I think this is a foundational report for the council, but it could also extend into other. And I know other organisations have their own green plans and their own health plans, but what's really good about this report is the way it brings together in a comprehensive way all these points about which many of us, there aren't, with respect, there aren't many new points in here as such, as a point, as a factor that many of us haven't thought about as such at times or haven't been discussed. It's a way it brings it all together and makes such a compelling argument about health and the co-benefits. So I think that's a really good idea. And I know I spoke to somebody from the ICB a while ago about a healthy weight declaration, in the hospital healthy weight declaration, because the council have one. But I know there's such a thing as a hospital healthy weight declaration. And then, but I do, the fact is that the health service is going through, a huge amount of reform at the moment, isn't it? It's got an awful lot on its plate. But what I'm thinking, and sorry if I'm repeating your point, Andy, but I think it's to do specifically, which we're coming on to in a minute, Nikki, this health plan. We're talking about these neighbourhood health hubs or centres, or, so, having taken away from the hospitals, because the hospitals, as far as I understand it, create enormous amounts of waste. And whether this kind of sense of, I'm sure it's already there, but, whether we could ensure through these report and recommendations and other discussions that it's desperately embedded into the next steps for the NHS and its neighbourhood plans. It's something we perhaps come on to later, but that would be really exciting to see, I think. But I do appreciate at the moment the NHS is hugely in turmoil. Lucy.
Yeah, thank you. And I really appreciate the subject you've chosen for this year. I think it's as I've said, it seems very timely. I just want to know a bit more how we take those recommendations forward. Obviously, Paul's offer of come and do something with me is absolutely great, but we've got 21 recommendations there. Is there an action plan that's now developed for this? How do we, as presumably the receiving body for this, actually put some weight behind that and get the various partners and organisations to move on them? And I think that's particularly pertinent with that comment from a young people, that people are waiting for leadership.
Yeah, thank you. So what the team have done in developing this have worked really closely with the climate team within the council and aligned the recommendations alongside the council climate action plan. So there's a synergy between those things that we're asking for the council as an organisation and the action plan that we have in place. So for some of these actions, there's already a route, but I absolutely agree that for some of them, we need to monitor those separately, and that will be we will be taking that on to pull that together. But obviously, we can't. Some of these actions relate to partners, don't they? So we can't make those happen, but we just ask that partners would work with us in developing and in reporting on those.
Thanks, Lucy. Councillor Kerr. I mean, I agree with you. I mean, we have an issue about getting a backlog of issues that need to come back to this Health and Wellbeing Board, and that's an issue in relation to time and trying to have neater agendas where we have more, fewer items where we can discuss them more. Nevertheless, I think it would be an idea to bring back, if we agree the recommendations, it would be an idea to bring back some sort of actions around it that are already in place and discuss further actions, because there are so many recommendations. I think that's a good point to raise, Lucy. Amjad.
Thank you, Robin, for the report. I think it's important to acknowledge some of the challenges as well, especially around active travel, because we know there's a significant amount of work that needs to be done around active lifestyle to encourage active travel. Some of the challenges that we've been facing in the communities through one of our programs that we've been running, which is funded by Sport England, in trying to get some of our most inactive communities active, is the lack of public spaces, green spaces available in our deprived areas. So the average nationally for deprived areas is 9 square metres per person in a report from Friends of Earth Access, one of their tools. But for our deprived areas in the city, or most deprived areas, it's 1 square metre. So, and then you add the layer of complexity of environmental barriers, spaces not being safe. It just adds that more challenge, and I think we've got to work at that collectively as a system to address these challenges for us to be able to get to that active travel point.
Yeah, thank you. And I think that's the work that we're starting, and is almost in train, isn't it? Around the active partnership work. But yeah, absolutely. It's about, as mentioned in the report, these issues disproportionately affect certain populations, and certainly our most deprived populations are one of those. And it's what we can do to think about how we change that for people. But that is part of that work, isn't it, that's ongoing, that we're working on together. Yeah, thanks.
Thank you. Yeah, I mean, just to add to that, Amjad, I mean, interestingly, on page 32 report, there is a map which shows the percentage of households with access to green space, and that's measured in terms of proximity rather than ratio of space to population. And if you look at places like Normanton and Arboretum, they're in the 100% category. So the issue is there, and there are other areas like bits of Mickleover, particularly, where there is less direct access to green space. So I think the issue there is to do with the nuance, isn't it, of the density of the population relative to the space. And I know we have, some of us has been quite concerned that old Bowles Green remains green. and that is happening. So there, you know, there is. I'm not suggesting there isn't a problem. I'm saying there is an awareness, and it's actually about the volume of space, isn't it, rather than the proximity. But there are, you know, there are things being done to ensure that it's not swallowed up in even more housing in those sorts of areas where, as you say, it's a bit full. Anybody who can travel, though, would encourage them to travel to some of our other parks in other parts of the city, which are often not so full, you know. And I know some people can't travel, but that's something I'd like to see happen as well, where we encourage people to say, hey, well, it's only like it's a mile away, you know, you can get to a big park, it's practically open. So anyway, but those things are on, I mean, that don't solve everything, but it's certainly something that we're aware of and need to do more on. I agree. Thank you. Any other comments on Robin's report? No? Well, I'd like to then thank Robin again for the report and all the children who did all the artwork. I mean, I did have the pleasure of judging the artwork along with, not judging it, but we did judge it, I suppose. We chose a winner, didn't we? But we highly recommended all the submissions because it was fantastic to see the work of all these little young children. It was a real pleasure, and the artwork is so good, and there's so much detail and so much thought. And Robin?
I was just going to say we're working with the Market Hall to arrange a display of all of the artwork in the Market Hall, so hopefully that will be, I don't know, Alison, if you know.
It's planned on opening, I think, in the next week or two, and should be open for most of the summer. So we're just waiting for them to come back to let us know exactly when and kind of where in the Market Hall it's going to be. And it's also, I think, at least the winner and things are going to be appearing on some of our bus stop displays and things as well. So you will start to see it around. And there was also a video that the university did of some of the artworks that they took around through some of their shared initiatives kind of earlier in the year as well, and we've got kind of the video of that, so we'll be putting those on the website as well.
That's excellent. Thank you. Thanks a lot, Alison. That's fantastic to hear that. And it is really positive. That it gives a kind of a really positive perspective on an input to a rather difficult and pressing subject, doesn't it? So that's fantastic. So I'd like to say thank you to all the children for their input, their art input and their discussion input to this. And thank you to Robin for producing this report. I mean, we can't leave this report here. It has to be disseminated and embedded, I think. So first of all, I suppose we've noted the contents of the report. And then we're requested to support the recommendations set out in the report. There are, is it 22 or 23 of them? Are people happy to support the recommendations of this report? Yeah. Brilliant. Thank you very much. And thank you. So now we move on to a kind of related report also being presented by Robin on the air quality strategy update. Thank you.
Thank you. And I start with an apology that Carl, who's our expert here on air quality, is away at the moment. So you have my presentation of his report today. So, and just to say there should be an appendix to this report, but we're just waiting for final approval to publish that, aren't we, Alison? So hopefully by the end of this week, we should be able to circulate that to everyone. But the key points are picked out in the report. And that relates to our annual statement, our air quality annual status report, which will be a published report. So the air quality strategy for Derby and Derbyshire is reports into the Health Protection Board, and the Health Protection Board is a subgroup of both of the Health and Wellbeing boards. So that's where the air quality work sits from a public health perspective. Obviously, Carl's work sits very much with the council itself. And And we know, as we've just discussed, the significant impact of air quality on health. And we also discussed that the obvious issues around health, around heart and lung disease, but also some of those broader issues, particularly in relation to cancer and dementia as well. And we know that air pollution is a significant impact on the cost to the NHS and to general society, and is why we have these strategies in place in order to tackle some of that, and that the most vulnerable in society, particularly children and the elderly, those with long-term health conditions, though in our most deprived communities, and as we mentioned before, pregnant women are particularly vulnerable. So when we look at the local air quality management that the environmental health team within the council manage, they look particularly at 3 key pollutants. So nitrogen dioxide, sulfur dioxide, and particulate matter. So the 2 gases, and then particulate matter, which, as it states in the report, is anything in the air that is not gas and is about small particles that can penetrate the lungs and cause health issues. So air quality has improved significantly in recent years, but there are still some areas for local action particularly. And the Derby and Derbyshire Air Quality Strategy was refreshed in 2023. We did have an update earlier in the year on the refreshed strategy, but just to run through the 3 areas that the strategy covers is around facilitating travel behaviour change, it's particularly around active travel, reducing sources of air pollution, which mainly relates to transport sources and heat sources as well. So that covers how we heat our homes, and in particular, any wood burning within homes. And the 3rd area being measuring, producing plans and mitigating against the health impacts of air pollution. So accepting that there is a level of pollution, what can we do to protect individuals from that? As I mentioned, there was an update in January, and at that meeting there was a request to receive further updates, and so this is particularly reporting on our annual submission on air quality. So since that time, at 4.7 within the report, there's a list of activities that the council has been taking forward, so particularly looking at EV charging and infrastructure, sustainable transport hubs, expansion of the school safe haven traffic restrictions, which impacts on air quality and also safety for children travelling to school. Active travel improvements generally, bus route improvements with the strategic bus corridors, city centre to Derby railway station access improvement, and the strategic cycle link improvements as well. And there's currently a review of enforcement policy in relation to burning of waste, and there's going to be a study into the use of wood-burning stoves in the city, and particularly looking at where wood-burning stoves are the sole source of heat or where they're an additional source of heat for a property. So for a 2nd year in a row, all pollutant concentrations, including nitrogen dioxide, have complied with the national objectives at all monitoring locations. So that is good news about the impact of the actions being taken. In the coming year, there's some work planned around the Transforming Cities Fund, the Future Transport Zones Programme, Active Travel Fund, more on the strategic corridors, more work with the public realm, Pentagon Island Cycleway, and more on the active travel strategy. So there's a raft of activities that are going to be undertaken. And when we are able to share the annual status report, you'll see within there those air quality objectives and the measures that have been detailed and the progress on those measures to achieve them. So that is the report as it stands. Apologies that we aren't able to share the report at the moment, but as I said, it should be within this week. We should be able to do that once we've got approval.
Thank you, Robin. Yeah, this is another really important issue. It's a shame that Carl can't be here, but thank you for presenting it yourself. And obviously much of the activity around this falls under Councillor Swan's portfolio, and I know she battles with the Active Travel Initiative, so just a plug for Councillor Swan. So well done to her for continuing to do that work, and the team who deliver it, of course. Any comments on this? Councillor Kerr.
Thank you. This very much concentrates on external air quality, but obviously most people spend most of their lives inside a building. Have we got any information about air quality inside buildings in Derby, and particularly if people are using heating systems that are releasing gases into their atmosphere, and it can be as simple as using a gas hob? Do we actually know any details about that? Because that's going to have a significant impact on individual health.
So there is due to be the survey of how people are heating their homes. That is going to be carried out. And I'm trying to think, was there anything, Alison, within the housing stock condition survey that would indicate? I don't think there was. That was mainly about...
No, I don't think there was, but I can certainly go away and just check that, because it's a little while since I've looked at that. So we'll check. But I don't recall.
I think it's a really good question. I think it's very challenging, isn't it, to find a way of obtaining that information. But we can have a look at what those two pieces of work will manage to identify or not, and let you know.
Is there any scope to, when people are actually looking into heating systems, to be able to do any additional work on that?
We can definitely have that conversation with Carl and see what the scope of the work is.
Thank you.
Thank you. I mean, I think it's worth, we are not complacent, but it's worth pointing out that the city does comply with all the government thresholds, or is within all the government thresholds for acceptable levels of pollution or air quality. So I think that's a positive, but obviously we know that it could be better. It could be better than the government levels. I know the World Health Organization thresholds they have higher thresholds for acceptability, so they have more stringent thresholds, I should say. So I suppose we are aware of that. So there's always a lot more to be done. And as was stated previously anyway, the whole point about having more active, well, not the whole point, a point about more active travel is that it's usually better for the person who's doing the travel anyway, in terms of bringing some activity and health benefit to them. So even if everybody moved to electric cars tomorrow, we'd still be looking to encourage active travel, I think. But anyway, any more comments on this particular report? No? Well, thank you for bringing that, Robin, and we look forward to seeing the updated actual report. Thank you. So now I'm going to move on to the Joined Up Care Derbyshire Dementia Strategy 25 to 30, and is it Alan? Alan Reid? Are you presenting this
Thank
one?
you, Chair. Thank you for this chance to introduce the Derby and Derbyshire Joined Up Care Derbyshire Dementia Strategy for 25 to 30. I was supposed to be joined by the programme leader at the ICB, Claire Bernanke, who led the project management on the strategy, and also our own Michael Rose from the Adult Social Care team, who's the lead commissioner for dementia, but unfortunately they're not able to join us today. In terms of, we've got the PDF of the strategy there. It runs into some 43 pages, so I'm going to suggest if you could drive and the slides, and I'll just pick out some key points rather than go through the whole thing. Also within the report that was submitted, there's a implementation plan that covers the first year as well, and I think embedded somewhere in that there's an engagement survey results that was carried out. So there's quite a few things that I'll refer to in my report, but we start on page 4 of that. That's the one, yeah. So we'll start on that. So what I'm going to cover in this presentation is the local and national context of the new strategy, the 6 core living well with dementia themes that are contained in that, and introducing one of the new ones, which is the waiting well strand. A bit of a covering of how we engage with people with lived experience and the partners in the strategy development, and the high-level implementation plan and the next steps. So just by way of context and rationale, dementia affects 1 in 11 people in the UK over 65 and is now the leading cause of death nationally. And as our own population ages, local prevalence is obviously within Derby is going to rise, just like it will elsewhere in the UK. Estimated that 1 million people with dementia are living with dementia across the UK, and of course that translates to a growing number right here in Derby. Dementia incurs a high human, social and economic cost, of course. People with dementia not only suffer from cognitive decline, but also there's higher rates of associated aspects like infections, falls, delirium and other complications. And the impact on carers themselves, often older, who frequently face multiple complex health and wellbeing challenges that go along with that. Now, nationally, the government's challenge on dementia from 2020, along with the NHS long-term plan, which has recently been updated, of course, now, and the NICE guidance call for stronger action in dementia around prevention, timely diagnosis, integrated support, and personalised end-of-life care. So the previous strategy for Joined Up Care Derby from 2020 to 2024 had some really positive outcomes. It improved diagnosis rates above the national average, increased community referrals by 40%, introduced dementia specialist nurses, so-called Admiral nurses, in acute and community settings. It created a new palliative care service and established a young age onset and rare dementias working group. But we know there's some gaps remaining there that this new strategy tries to address. Some delays and areas of improvement include working on delays before dementia assessments, some inconsistent pre-diagnosis support, and limited information that capitalises on brain health education and the role of prevention and early intervention in delaying and actually preventing dementias based on new evidence that up to 40% of dementia is preventable. So the new strategy builds on those achievements before, refreshes the vision under the Living Well Dementia framework, and importantly adds a couple of cross-cutting emphasis on that prevention and brain health, so helping people to reduce the modifiable risk factors early, and that waiting well aspect, supporting people from their first concerns and their families' first concerns of dementia right the way through to a formal diagnosis. So can we jump on to slide or page 16, and it's the one where I'll tell you when. No, keep on. No, another one. That's the one. Thank you very much. So this slide shows the 6 core areas, and that follows the well-established dementia pathway from the NHS with the addition of that living well aspect. And for each of them, the strategy sets out a vision, priorities, key messages and commitments. So I'll go through each one quite briefly. The one that in public health that I was most involved with is that preventing well, unsurprisingly, with that early intervention prevention aspect. So the vision of that is that everyone has accessible information to improve brain health and reduce dementia risk. The priorities is that based upon the fact that only a third of UK adults know that dementia risk is modifiable. So this aspect aims to raise awareness of the 14 evidence-based lifestyle factors, which is in the strategy and outlined in that. And there's some factors such as controlling blood pressure, staying socially and mentally active, avoiding smoking, reducing alcohol intake, as covers so many of these common risk factors, maintaining a healthy weight, of course. And we know that evidence shown that it can delay and prevent up to 40% of cases. So the key message that we're trying to get with that common risk factor approach is what's good for the heart is good for the brain, and it's never too early or too late to start looking after your health, and that risk reduction benefits overall health. The next one is diagnosing well with a vision of timely, accurate diagnosis and personalised care planning, with the priorities around early diagnosis, improving the coping, planning and prolonging independent living. Key messages around that are the diagnosis reduces uncertainty, that waiting support is vital, and it's the stigma and service gaps currently deter people from seeking help. So there's a commitment to embed memory assessment pathways in acute hospitals, extend community memory assessment services, reduce diagnostic waiting times and ensure post-diagnosis care plans, including care and wellbeing. The new one around waiting well, you might think that's perhaps not a particularly positive message to give around waiting well. Why should people have to wait? And that's one of the things that was picked up in engagement consultation with people. But we know that there's pressures on the NHS. We know there's waiting times. We know that inevitably with any diagnosis and pathway, there is going to be a period where people affected and their families are going to have to wait for a period, even though we would like to keep that as short as possible. But it's really a case of that people have a proactive self-care advice, future planning and support while awaiting assessment and formal diagnosis. Recognises through the priorities around that anxiety and uncertainty grow during waiting time, and there needs to be accessible information and interim support to ease that anxiety and to help manage the emerging needs. So the key messages link in with the prevention aspect about brain health tips, keeping healthy generally in a more general sense, legal and financial planning, for some example increasing the awareness of lasting power of attorney, and then practical guidance on daily living with care support as well included in that. So the commitments are in the strategy are developing a waiting well toolkit, signposting to voluntary sector and peer networks, embedding waiting time check-ins in primary care, supporting well the vision around high quality integrated support pre and post diagnosis for people with dementia, with a priority around seamless person-centred care, reducing repeat assessments and frustrations. Key messages around that, around respect, around lived experience, recognising rare dementias, integrated specialist teams with primary, acute and social care, and the value of peer support. And some of the commitments that are made in the strategy are around implementing shared care records, expanding the Admiral nurses and voluntary and community sector partnerships, and developing culturally specific support offers. And that takes into account another golden thread running through the strategy is around tackling inequalities and inequities around dementia care as well. Living well, the penultimate aspect of the strategy takes the vision that people with dementia are understood, included, respected and supported within their communities, with a priority around developing dementia-aware communities to better enable social inclusion and independence. Key messages on the strategy around the living well are making sure that there's accessible information on extra care housing, respite for carers and peer support for carers, community understanding along with assistive technology and navigation support. And some of the commitments around that in this iteration of the strategy are rolling out, as I said, dementia-friendly communities accreditation, investing in assistant technology pilots, and strengthening community partnerships and peer-led activities. And the final one, dying well. A vision is that people with dementia can plan for and experience a dignified death in the place of choice, with priorities around early shared advanced care planning and integrated palliative care support to improve end-of-life outcomes. The key messages that we want to get out in the strategy are around recording and sharing choice for people as their dementia journey continues, involving carers in that, normalising advanced care discussions and supporting home-based dying when that's desired, and providing post-bereavement care. So some of the commitments that are linked to that are standardising dementia-specific advanced care planning templates and training all frontline staff in palliative approaches and ensuring the wraparound domiciliary and hospice links. Can we go back, forward to the engagement, back a bit to some of the engagement? It's in number 12, I think. That one there, thank you very much. So just a bit on the engagement and co-production that was involved over the 12 months in the production of this draft strategy. Surveys were held, focus groups, there was a number of memory marketplace events for people living with dementia, their carers, voluntary sector and statutory partners. Some of the things we heard calls for at those events were greater dementia awareness across all services, more brain health education, joined up timely support pre-diagnosis, shorter waits for memory assessments, better carer respite and peer networks that we've picked up, and earlier and more sensitive end-of-life discussions. So hopefully some of the aspects that I've described in the strategy I've picked up in that. And those shared lived experiences and insights directly shape the priorities and commitments across all the pathway themes. So the Dementia Strategy Group also involved a wider implementation partnership, including representatives from city and county councils, the ICB and provider trusts and the acute care and primary care and the voluntary sector. We're all involved in co-designing this strategy and overseeing its rollout. So can we go right towards the end, 5 from the end, number 38? It's about the implementation and next steps. Sorry for all the jumping about. And just go further forward. Back a bit, next steps. Yep, next steps will be fine. So a detailed live joint implementation plan is a core within the Dementia Strategy Group. The key milestones by the end of the strategy life at 2030 include a comprehensive brain health campaign that will be launched and evaluated, diagnostic waiting time targets achieved, waiting well support services operational across all primary care networks. There'll be expanded admiral nurses and voluntary sector dementia workforce by around 20%. There'll be dementia-friendly community accreditation in all Derby City wards. There'll be advanced care planning uptake, that should be doubled. More equitable access improvements for younger onset and minority communities, and that golden thread of inequalities running through the strategy. And there's also going to be active monitoring and reporting annually to the board on population prevalence and demographic shifts, demand capacity and performance metrics across the pathway themes, resource needs and business case development for emerging treatments, and delivery will primarily be within existing budgets, so it will be a case of reprioritising resources for greatest impact and targeting business cases as needed for novel therapies and digital solutions. So as we move from strategy to action, some of the things that have already started in that implementation plan, just to be highlighted. In terms of preventing well, we've finalised materials for a city-wide and county-wide brain health and risk reduction campaign, including posters and integration into NHS health checks. With diagnosing well, we're maintaining a strong diagnosis rate, currently 69% at the time of writing this report, which is above the national target, and we're also reducing waiting times. Also working to expand diagnostic access in disadvantaged communities and within care homes. Around waiting well, we're ensuring that people waiting for memory assessments are supported with information, signposting and culturally appropriate services to minimise distress and uncertainty. With supporting well, we've sustained dementia care plan review rates above 70%, expanded co-production for carers and people with lived experience, begun scoping out a county and citywide dementia hub for information and navigation, and processing work on long-term condition management, delirium awareness and training needs. With living well, planning is underway to assess accommodation needs and community resilience. That ensures that people can continue to live independently and inclusively as possible, and also beginning focus work on young onset and rare dementias. With dying well, specialist dementia palliative care service has been rolled out and piloted at primary care network level, with a view to evaluating its impact and integration by the second year of implementation. So finally, just the ask of the Health and Wellbeing Board, and this is to ensure the ongoing successful delivery of the dementia strategy. We're asking board partners to do 3 things. Adopt the strategy formally within your own organisation. Try to ensure that alignment with your own strategic priorities and delivery plans to see where dementia care can be integrated into that. Champion the dementia agenda across your services, encouraging dementia awareness training for your staff, supporting innovation, embedding the strategy principles from prevention right through to end of life across your workforce, any commissioning responsibilities you have, and also community engagement, and supporting the implementation of the strategy by actively contributing to the multi-agency dementia strategy group where you can, sharing data, expertise and insights to refine delivery, promoting co-production lived experience at every stage of the strategy, and enabling system-wide integration and reducing fragmentation and duplication. So just the final point is the strategy is not a standalone document. It's a shared commitment to build a more dementia-aware and inclusive and proactive system across city and county. And it's relying on the leadership and collective action of all partners within the Health and Wellbeing Board and other forums such as the Integrated Care Partnership and the Placement Partnership, where the strategy has already been to make the vision of reality by the end of the strategy. So thanks once again. I'm happy to take any questions.
Thank you, Alan. That is another really comprehensive and important report. There's a huge amount of work's already gone into it. So thank you for that. Do we have any comments or questions for Alan? Andy Smith, hand went up.
Yeah, thanks, Chair, and thanks, Alan, for that really helpful overview. I think it's a really strong, comprehensive strategy. That's the first thing I want to say. I think just the way it's been presented, it was really readable. The way you've used graphics, text, it told the story really well. So a lot of work obviously went into it. I think having it extended over 5 years makes a lot of sense. And I think it just gives us a reality check of what we need to try and achieve as a system over the next 5 years. So I think that felt more realistic and clearly good levels of engagement. In terms of the vision, I think having that focus on prevention is really important. 40% of dementia is preventable. That's a really powerful statistic for us to be mindful of. I think just around some of the learning from other parts of the system around waiting well, I think that we can sometimes make assumptions or just assume that families, individuals, carers understand what's available for them when they're waiting well. In terms of information, services, support. And I think we shouldn't take that for granted. We need to keep challenging ourselves as leaders across the system around ensuring that information is clear, accessible, that people know how and where to get it, and not just assuming that people know where to go, because that clearly isn't waiting well. That just increases people's frustration and can sometimes prevent them just getting a piece of information that could make a real difference to their lives. So we need to just, I think, reflect on how we test ourselves over the next kind of 3 to 5 years so that we are evidencing and assuring ourselves that people are waiting well in that space. And I think you've already touched upon it when you were summarising at the end, but whilst you were talking, there was just something for me about, how do we ensure this strategy reaches all our communities across Derby, both in terms of access to information, in terms of what's out there, that we're kind of engaging all the communities that live across the city in terms of understanding the impact going forward. So I think you touched upon that in terms of all wards, but I just think we need to be really kind of clear about how we do that from a kind of EDI perspective. But I think it's a really good piece of work, and I think the Health and Wellbeing Board recommendations are the right ones.
Thank you very much. Yeah, just on that, I think when you've got a ICB joined up care strategy that's county and city, one of the risks for us as Derby City is to get overshadowed or get pushed out. It's very can be county focused, but I've certainly taken it to the Place Partnership Board. There's a lot of engagement for that, and certainly throughout the work on that, I was really acutely aware keen to get that city voice there. So with the change in landscape, with the change of place to neighbourhoods, the stronger focus of primary care. I think that's something that we can use within Derby City in that smaller footprint to really take that forward.
Thanks, Alan. Would you mind talking to the mic, please?
Oh, sorry.
We're a recorded meeting, thanks.
Sorry,
and also,
Chair.
would you mind turning the mic off when you're not speaking? Thank you, because otherwise it suppresses the other's voice. But thank you. Andy Appiard, and then...
Thank you, Chair. So, Alan, thank you to you as well. I also wanted to just say I really welcome the report coming. I think it's an absolutely fantastic strategy, and in terms of adult social care, some of the pressures and the issues that we're facing, we're starting to have discussions within the service about whether or not we're supporting people within our mental health teams instead of our older frailty teams, because that dementia progression is meaning that it's a different presentation for us, and do they need to be supported by different professionals and different teams. If you are in any meetings with me, you'll hear that I think that prevention is the key for absolutely everything, and when 40% of dementia is preventable, it really is our duty to be working in that space. So I think that we need to be doing that to support people, but we also need to be doing that because of the rising demand that are facing adult social care services. So trying to pull those strands together, I think, is absolutely key for me. I second a lot of the things that Andy has said, and so from my point of view, from Derby City Council, really happy to accept the recommendations that you've put forward and try and work with you as best as we can in that space.
Thank you very much.
Thank you, Andy. Councillor Kerr.
And I was going to pick up on the importance of that prevention thing as well, which, isn't it lucky that the things that we need to do to prevent dementia are so much the things we need to do for health in so many other directions. So it's just reinforcing all the things that we should be saying to everybody anyway. And I think that is really helpful. The question I had, though, is particularly about the statistics, that if we're diagnosing, I think you said 67% against a target of 65 or something like that, how do we actually know how many people there are overall with dementia? You know, if we don't know that they've got dementia, how do we know what our total is?
So prevalence models, it's called. So you can model a prevalence using statistical analysis.
So how do we not know that sort of we've identified 99% of them, and Derby's prevalence is lower because we're generally fitter? You know,
it could be, but certainly over time you can see by the number of people that are being diagnosed, you can then make statistical inferences around the population. So there's sophisticated, statistically advanced, sophisticated ways to build in that prevalence model. Which are beyond me. I used to understand them before when I did statistics. I've probably forgotten, but yeah, there's fairly robust ways to estimate pretty accurately with some degree of certainty, and you'll have a confidence interval in that. You'll have a period where it sits between that range, and it's obviously related to sample size, but that's mapped across, and of course other countries and other areas will have different prevalence for that. So. In other areas of the country, you'll find different ranges. So, but yeah, I would say it's quite robust and it sits within a range quite accurately.
Okay, may I come back on that? Because for some people, the idea of being diagnosed as with dementia is a burden, it's a challenge, it really knocks them. And actually they don't want to know that they've got a diagnosis. And if we've got the ideal of having supportive and responsive communities who are accepting of people of all their things, they don't actually need a diagnosis because there isn't that much that medicals can do about it. So I'm just wondering what is the advantage of knowing our correct percentage and potentially those correct individuals?
Well, certainly with the more evidence that's coming through for that preventive aspect, that's relevant to all stages of dementia. And even though perhaps you, once a diagnosis is established, there's not much to stop that course of the disease, there's certainly things that can improve the quality of life, not just for the person affected, but also for their carers and their families and their loved ones. So it is relevant to find out, so then positive action can be taken, and also the aspect of towards end of life and dying well towards that aspect in terms of having a diagnosis so you can start planning is really valuable again for the person affected and for their family as well in terms of advanced care planning. So it's planning a death, a good death as well, and the palliative care aspects that are in the strategy. So yeah, although a diagnosis may sound grim and it's not what anyone really wants, there's a lot of advantages for individuals and their families and their loved one to get that diagnosis.
Thanks, Alan. Thank you. Yeah, I'm really mindful of time, so I'm going to bring in. Thank you. I'm going to bring in Margaret. Probably as the last question, and then we do need to move on because Nikki has made a lot of effort to get here as well to look to the health plan. So Margaret, thanks.
Oh, thank you. Brilliant technological intervention. Thank you. And so, to me, this really links with the 10-year health plan, doesn't it? That we're saying let's move from treatment to prevention, acute to neighbourhood, and this importance of a holistic approach within the neighbourhood. And I've seen it work and not work, and where it works, it's absolutely fantastic. So it's creating that kind of parity between neighbourhoods, and I suspect we may have some health inequalities where not all neighbourhoods are as responsive and resilient, but the more we can do in that area, I think the better. Thank you.
Thank you, Margaret. Thank you. And I think that's fine, Alan. I'm mindful of time, so I'm going to take that as a comment, which is a very useful, and I endorse that comment because I was also interested in the idea of the dementia-friendly community accreditation, given that the Mental Health Trust is interested in creating a dementia-friendly city. I think it probably aligns, so it's something we should talk about more, Alan. But thank you very much for that report. It's a really excellent report. And so very quickly then, because we do need to move on, our recommendations are we have to note the content of the report, which we've done. We've discussed this and the implications. And we're also asked to agree that the report should will come back annually. Now, I'm really happy for this to happen, but and I think, why wouldn't we do that? And I think we need to do that. I just really am mindful of the fact that we have lots of reports. We have a backlog of reports to come back on reports. So I think if everybody's in acceptance, we can agree to take an annual update, and thank you for offering that. I'm sure we'd want to have it, but we may have to think through about how many reports we can get into a meeting, or slightly extend the meetings and have a slight break. But it's something to think about, because we're currently running on a backlog of reports. But thank you, Alan, that's excellent. So is everybody happy to accept those recommendations? Thank you. Okay, now I'm going to move on very quickly then, we're just a little over time, to Nikki Doherty, who is from the ICB, and she's come to give us an introduction for some and an overview for others of the government's 10-year health plan for England, the Fit for the Future. And I'll just remind everybody that Nikki is reporting on this plan, and this is a government plan. And actually, I've been in a few meetings this week where we talked about this, and it's interesting that in some of the details, there have been ardent different interpretations in each case. But I think I've looked at what you've written, Nikki, and it seems really helpful. So if you'd like to give us a talk on it, thank you.
Thank you very much. So I'm Nikki Doherty, I'm the Director of Place and Partnerships, and I am working in partnership with partners on our neighbourhood model in Derby and Derbyshire. So I'm not going to focus on the 10-year plan as such, but more our kind of approach to doing the neighbourhood bit, which is central to the 10-year plan, and it's 3 shifts. I normally do this act with Dr. Penny Blackwell, who is at the Neighbourhood Executive, but Robin Jewis is going to be my interrupter this time. So we haven't done this before.
Very quickly, Nikki.
Sorry?
And could I introduce you really quickly? And for the sake of anybody in the room who isn't familiar with this plan, because there will be some, and some people watching, would you be able to give us a 60-second...
It's in there, don't you worry.
You're going to speak about what the plan is.
Don't you worry, we'll give you a bit of an overview on that.
Thank you.
Don't worry. So, yes, Robin will sporadically interrupt me, which gives her an opportunity to get me back for my very noisy late entrance during your presentation. So we'll go with that one. So if we move on to the next slide, just as a bit of context, this is all about the kind of shift from hospital to community, prevention to treatment to prevention, and includes the kind of use of digital. It's all very exciting, but actually it's not new, as we've said with a number of different things. So it's been around since 2012 when the Health and Social Care Act came out and we had a duty to integrate. And since then we've been talking about integration, and we have been talking about a left shift from hospital to community and various other things. And we've had multiple reviews since then. So we've had... we've had kind of policies. So we've had Section 75s and 65 Z5s. We've had the PCN kind of DES, which was bringing general practice together around neighbourhoods, all with the ambition of helping us integrate. And then we have had reviews from the Hewitt report, Claire Fuller looking at kind of layers of skill in primary care, Lord Darcy most recently. And whilst they were all very exciting in their findings, actually what they were telling us is collectively we have not made the progress on integration that we ought to have done at a national level, and we need to do more. Now, quite exciting in Derby and Derbyshire, we've done rather a lot, in fact, and I would argue, coming into this system new, probably we've done rather a lot more than other areas have. So when you go to other areas, you quite often come across a very glossy model that looks quite exciting, and it's got like an organisation here and an organisation here, and they say what they all do, and that sounds very organised. But when you scratch underneath the surface, actually, the level of integration is quite low, and the examples of what they're doing are quite few. Whereas when you come to Derby and Derbyshire, we've got some really fantastic examples of where we've genuinely come together in an integrated way to make differences for our populations. So we've got some of the things on there, Team Up, some of the empowering general practice, some of the end-of-life stuff. When I go out and talk to people, there's absolutely loads of stuff. There'll be children's stuff. There's just loads of stuff that we've done. But we haven't organised ourselves. We haven't put that form in that kind of brings the function together, which means we haven't realised the full scale of the benefits. The other thing that I would also say we can do is we can measure the impact of some of those things, so we are seeing some of the benefits, but we haven't fully adopted an approach from a system engineering perspective where we've been able to scale up those benefits, and that's some of the stuff that we need to do next. So if we go to the next slide, this is your quick overview on what the plan says, and I can't take any credit for it because it's the fabulous Carnel Farrar who have done their usual thing. But in summary of what the 10-year plan says, the NHS is on the edge of what it's of its sustainability. We've got financial problems, we've got demographic increasing needs, all of the things that we've spoken about for many years in our health and wellbeing plans and integrated strategies. There are three major shifts from hospital to community, analogue to digital, and treatment to prevention. The treatment prevention identifies some key areas, so tobacco, alcohol, obesity, mental health, things that we've already got as priorities in Derby and Derbyshire. Big focus on the NHS AB from analogue to digital, and then from hospital to community, it's very much heavily focusing on the development of this neighbourhood infrastructure. And then there are some underpinning kind of things that would do that on the next slide, which I won't go through with you, but they are things that we already tend to recognise. So the important bit then comes on to, next slide, what it means for Derby and Derbyshire. And I'm not going to spend time telling you about Derby and Derbyshire because you know about that well enough. So if I flick just not the next slide and then the slide after. The bit that I just will dwell on for a moment is our spend profile. This is an NHS spend profile because I very lazily just grabbed it from an annual report in the NHS. But one of the things that we have been talking about since 2012 is this shift of spend and resource from acute to community. And yet, probably if we look at our spend profile over time, very little has changed. And one of the things we need to start doing in our partnership space is agreeing what, in our 10-year vision of what an ideal functioning health and social care system looks like, with patients who have great autonomy and independence and control of their well-being across, with reduced inequalities, etc. We need to be clear about what the spend profile needs to look in 10 years' time and start planning about how that's going to shift. And that shift will happen largely through our increased levels of integration and how we work together to deliver services differently and more effectively with the money we've got. Next slide. So just to not jump too far ahead and just focus a little moment on what are the problems we're trying to solve. So there are four key problems that we've summarised, and there'll be other ones, but it's kind of a neat encapsulation of what it is. So first of all, we've got a disempowered population that are increasingly dependent on our interventions, both through health and through social care. We've quite often created that ourselves because we've created very short, siloed interactions with them that don't get to the nub of what's wrong, what's the matter with you or what's the matter with me, and therefore increased demand, and people just, They want a solution. They don't take control of their own lives, and we're not supporting them very well to do that. We've got an ageing population in there as well, haven't we? So increasingly more complex. Difficulty enabling local innovation and maintaining system-wide insight, and we've seen that a little bit in the team-up space. So where we let go of things and allow people to create, they do really brilliant stuff. But then we can't really understand what they've done at the top, as it were, so we don't really get behind scaling it up or moving it forward, because we spend a lot of time questioning, like, what is it that you've done and I can't see it? And equally, when we try and control at the top, what we do is hamper the innovation and the kind of ability to move forward, and we don't go forward at pace. So one of the things we need to do is tackle that conundrum and bring the two together, close the gap. We've also got lack of scalable accountability frameworks. So if you think about pushing more into the communities and like budget working together, have we got the confidence that we would be doing that in a safe and supportive way? What's the governance and the frameworks that we would do that at scale? And we need to work a little bit to make sure they're in place. And then a lack of infrastructure for managing pooled budgets, which hopefully you will be all as passionate about as I am, because I'm one of the Better Care Fund leads, and that's one of the things that was supposed to do, was help us pool resource to integrate, and there's much more we could do in that space if we got that infrastructure right. So next slide is the what we're hoping to achieve, which isn't the problem statements. And I have got in here somewhere, so I can do desired outcomes. So this is we've gone for 4, and I have fudged the bottom one a little bit to incorporate as much as I can. But we've gone empowered local decision-making through scaled collaboration, a culture of trust and accountability across the system, improved health outcomes with local tailored delivery, and then, importantly, providers and people who are supported, resilient and connected. And that means people who are in control of their health and have greater autonomy and understanding about how to be well, but also a provider landscape that is appropriately designed to be resilient and do what we need to do in the future. And we've probably at the moment got a few too many providers who are not feeling in a resilient, stable place, including some of our bigger NHS infrastructure. Foundations, next slide, of our neighbourhood model. I won't dwell on too much because, and Robin, do feel free to just jump in, I'm used to it. So foundations are, we've built the neighbourhood model on establishing really strong culture and relationships. So we've taken quite a long time in Derby and Derbyshire to build our relationships, and they are health and care relationships. Our local place alliances, our local partnership boards, the links into health and wellbeing, are really, really important and have enabled us to be able to do some of the things that we've achieved. We'd operated a distributed leadership model, which is about that empowering local decision-making, and where we've managed to do that, we've done it well. And we've really recognised the strengths and assets in those local areas to be able to do the right thing for the different areas. So you'll actually see for Team Up, whilst we've done the same thing on a global basis, the way it's been done differs because that's importantly different in each of the places we've done it. And then our teaming up approach, which is we have really taken time to think about the population we want to help and what we want to change for that population, and then who needs to come together to do that, rather than doing the classic glossy version, which is we need an organisation and we need everybody to be involved in it, and let's just invite everybody in. So next slide. Is where they kind of, I'm not going to dwell on that, is our features of effective leadership, which you can read, but we've been quite clear about the behaviours that we want to use in this space, and being very much about setting the conditions for success. You'll all know this well, and I'm not going to, we haven't got time to go into it for it long, so I'll go to the next slide. So this is our integrated care model. Which you can't see yet, but you might be able to see in a while. It's basically, there's nothing really excitingly new about this apart from we put it into a table. But there are 3 layers to our model. First of all, you've got that purple layer at the top. You have a layer of population around 30 to 50,000, which looks a little bit like our primary care networks at the moment. So that's really good evidence base that that's the level of care of scale where you're coordinating the delivery of services to make a difference for populations. There's international evidence, there's national evidence. So that will be our integrated neighbourhood teams, and they will come together to deliver care for their 30 to 50,000 neighbourhood. And it will be designed again around population need rather than let's just have somebody from every single possible organisation. So we've been fully integrated. It will be what's the population, what's the future need, what's the problem we're going to try and solve, who needs to come together in a team to do that. And that's also where you start designing a proper Better Care Fund and integrated pooled budget as well, because that helps you identify the resources that need to be in that space. The next layer, Neighbourhood Health Alliance layer, for us is 100 to 250,000. We think differently to the national team, and we think importantly so. We've challenged ourselves a little bit on do we need to adjust our thinking, and I'm open to feedback on this in the room, but our thinking at the moment is if we start trying to reorganise geographies that we have spent a long time making work and building relationships in, what we will do is set our maturity back to almost zero, because we'll have to start that work again. And actually, there's some really good stuff going on now. So we're quite protective of the model that we're proposing. So 100 and 250,000, which looks roughly like our local place alliance. Well, it will be our local place alliance footprints. A little bit of a question in Derby City, because as you know, there's some complexity around how they're working together. So we're doing some focused work with the Derby City lot about how we organise ourselves there. That will be a coordinating function, and generally speaking, we find that over history, we do find ourselves coordinating around that layer of scale. So there'll be, you could even see, for example, coordination of, and I'm going to go health here rather than anything else, but of on-the-day urgent care services would be coordinated at that scale, but delivered through your integrated neighbourhood teams. So you'd be able to access on-the-day GP or whatever it might be, urgent care slots that help you stay out of hospital or reduce the demand on same-day access, on non-same-day access and planned care to GPs. And there'll be a variety of things that we're able to coordinate at that scale that will improve things. And then the last scale is the integrated care and support bit, the whole system bit. And this is where your access to infrastructure comes around. So we were talking about this before the 10-year plan. The 10-year plan calls it an integrated healthcare organisation. They're being quite prescriptive about it at national level. And we'll take some of that prescription and we'll ignore some of it because we'll do what's right for Derby and Derbyshire. But essentially what that does is provide the infrastructure support to the rest of the system that allows people to do things safely and effectively through those layers of scale. So it will be things, it will have the high level accountability, it will do the important but sometimes boring things of governance and a kind of risk holding. It will provide access to training and support. It will help oversee pooled budgets. It will do things like provide access to expertise that would be very expensive to provide in each of those other layers. So it starts making those other layers more affordable to run safely and efficiently, and gives us the power to create the infrastructure and the frameworks that we can start delegating our pooled budgets through. And then just on the left-hand side there, we've set out some principles of how we will identify those geographies, which reflects, again, that it's quite important to us to recognise what's working already and make sure that we're working with what makes sense. Now, I'll just linger on this for a moment longer. There is, at the moment, there's an opportunity for us to make an application to be an accelerator for a neighbourhood model at a national level. It's not going to bring us any funding. Unfortunately. What it's going to give us, though, is access to influence the future ways of working and access to additional skills, capability training to help us take forward what we want to do. So we're really keen that we do that. The application process is that you can only have one application. No, you can have multiple applications, but for a place. So a place will be putting the application in. And so we have recognised we only have one place in Derby and Derbyshire in the integrated working we've been talking about. We've also recognised that's a useful position for us to have because as we're looking at what the local authority, unitary authority boundaries look like, going at this in an integrated one-place approach and continuing our ways of working means that we've got flexibility to adapt to whatever the future brings for us. So we are proposing that we put in a single application. Derbyshire Health and Wellbeing Board heard about this last week, and one of the things that we would like to ask is your support for that application going forward. And a little bit, as you referred to earlier on, it's a really good opportunity for us to start making connections into those wider opportunities, such as the dementia and the green strategy, etc. Next slide. I won't dwell on this, but I can take questions outside of it. This is starting to talk about what the integrated healthcare organisations look like. And just basically, this slide, the next slide, and the next slide talk about how that integrated healthcare organisation probably isn't one organisation. It's probably, well, by the nature of it being called an integrated healthcare organisation, it probably integrates the functions and capabilities and expertise of multiple organisations. So there will be a role for an integrator site, somebody with the governance, the infrastructure, the risk appetite to hold on to some of the risk and infrastructure for the system. There'll be a role for primary care leadership and taking forward the primary care bit. And then there'll also be a number of enabling bits that will be important to that, which we'll come on to in a second. So if we go to the next slide, that just talks about integration measures of success, which you may or may not recognise, so I'm not going to go through there. I know you'll have spoken about it in the other programmes multiple times, but it's important to us that we embed that in our future way of working. Next slide. And so this starts to show you that there are going to be key considerations to what our healthcare organisation looks like. There's going to be a real important bit, and that's why the integration measures of success are important, about how this organisation behaves and what it brings. It cannot be a controlling organisation. It can't be one of those ones that takes control, holds a budget and does all sorts of reporting. It has to be an enabling, empowering, trusting organisation. And that's going to be a real challenge for us, I think, in the public sector and something that we need to hold dear to. Next slide. This is just to say we've had a neighbourhood summit that was held back on the 14th of May that some of you may or may not have got to. I planned it all and then didn't go in the end because I was unwell, which was fun. But we're having another one on the 16th of September that will kind of start moving us further forward. This side just summarises the feedback that we had in terms of the thoughts on the form, function and principles we've set out, people's thoughts on what the organisational roles were. So we organised people into tables with an organisational identity, but made up of cross-sector people. So there was a bit of an opportunity for people to feed back what the organisation needed to be. And that's provided kind of some rich input to each of the organisations to think about how they move forward into that future space. And then some thoughts on what we need to do for delivery, which will help us shape our delivery plan. Next one. And so just, I suppose the last bit is, what does it mean for the Health and Wellbeing Board? This absolutely fits with the strategy that is here around having the best start in life, staying well and ageing and dying well. It fits into our integrated care strategy as a joint system as well. There's something about how the Health and Wellbeing Board sees the Integrated Health Organisation as a delivery partner for its strategy, because that's going to be a really key development in how we bring integration together and deliver our health and wellbeing outcomes. There's something about looking at the agenda for prevention and equity and making sure that we're using our joint strategic needs assessments and some of the intelligence that we have through here to inform what the outcomes need to be delivered through the IHO and the neighbourhood model. There is an opportunity for us, I think, to think about, as that integrated health system starts to work, we can improve the data that we have and the understanding of what's going on in our neighbourhoods and our communities, which sometimes isn't as strong as we would like it to be.
Nikki, I'm ever so sorry. Could you kind of, I know you're almost finished, would you mind sort of wrapping up?
It's the last one, and then just driving
a few minutes after 3 o'clock.
Yes, sorry. Then the last bit is driving and optimising the integration. So the Better Care Fund is a really important factor, and that's it done.
Oh, sorry. I was kind of wait and I intervened just when you were going to finish anyway. Apologies.
Perfectly timed.
Right, thank you. So very quickly, thank you for that. Before I bring Robin in, we are over time. I'm just going to allow few minutes for questions. This is so important, if the people don't mind. If anybody's got to leave, then obviously, please do. Obviously, you have to leave. We didn't have this on the agenda originally. Margaret and I set an agenda where we did have plenty of time for reports. This is, so just for anybody that we do have potential audience and people in the room who may not be so immersed in this, but I think it was about 3 weeks ago that the government published their 10-year health plan, having consulted on it widely over last year and talked about it for some time. And I think, thank you, Nikki, and Nikki's focus has been particularly on the neighbourhood model, which is particularly relevant for the Health and Wellbeing Board. And I think that will be of great interest to people. But just to stress that this is just a plan at the moment, so it hasn't actually been enacted in law. And until it is, all the existing relationships and structures and statutory bodies remain in place. So that's something this is not an overnight change. And it's a 10-year plan, so that's massive as well. And for people out there, I think my sense of it is what the government's trying to do is to take it, obviously take care away from hospitals, which is what the acute sector is called, and then put it more into the community, but also kind of individualise it a little bit, and try and also inject into the system some responsiveness to people's health needs that you need at a community level, but also an individual level. And in the individual level, you get that in a market system. We don't have a market system. I'm not a supporter of a market system, but you do get responsiveness. And I think there's an awareness that there's a lot of money gone into management and a lack of responsiveness. I think so I'm not, and that's what I think the context for it is. So I think there's a lot of great potential here, particularly on the neighbourhood working side of it, Nikki. I think there are issues, huge issues around this whole idea of community engagement and local responsiveness, which is poor at the moment, I think, or limited, shall I say, not poor. And I don't think there's a clear view as to how that's actually going to happen. But at least the ambition's there. So I will now shut up and I will just take a few comments. Andy, you wanted to come in.
Yeah, thanks Alison, and thanks Nikki. I suppose a question and then some comments and reflections. I think because of the significance of the 10-year plan and what this means for the Health and Wellbeing Board, but also just the future of our system in many ways, I do wonder whether, looking at our forward plan, this needs to be a bit of a standing item going forward. I don't think we can just look at it now and then come back to it in 12 months' time, notwithstanding the kind of challenge of, the reports that are stacking up, but maybe we'll look at that. I mean, many aspects of what's in the plan are not new, but, some have real significance going forward. I think, the neighbourhood health and local integration, I think, becomes the only game in town in many ways. And I think we have to really think about what that means in that transformation context. And I think that's why it's significant for the board. I think that there are many aspects that are working well in the system that does provide a really good foundation, which you've kind of reflected on, Nikki. And I think it does put us in a good place strategically as a system. I mean, we've got good strategic and operational relationships. We've got some good examples of place-based multi-agency working that is making an impact, and it is preventing people's needs for getting worse. It is preventing people going into hospital. Think about Team Up, for example. Think about some of the things that we commission through the Better Care Fund, like the Healthy Housing Hub, for example, the direct link between those services and prevention and hospital prevention. And that's really important. And we need to understand the ingredients that sits behind that makes that effective. I think that the overall agenda from the government around reform is really challenging, and this is one aspect of it. And we've got to somehow, as a board and as a system, make sense of that, haven't we? Both in terms of what the opportunities and the challenges and the opportunities are within that. So we do have to have an eye to local government reorganisation. And I think the approach that we've got at the moment around the expression of interest around being an accelerator is absolutely right based on the current configuration, and hopefully the way we develop things can be lifted and shifted into any configuration of what Derbyshire looks like, and that's going to be really important in terms of that future operating model. And I think for me, with the kind of children's hat on, because there's a lot in the plan that's really good about children and children's services, both in terms of the integration agenda, mental health and so on, which is really important. I think as we develop the neighbourhood model within Derby and Derbyshire, we need to keep thinking adults and children in that space as well, because we've got some significant reforms coming out of the government on the children's side around locality working, around family help, around child protection, and there's a real opportunity here to kind of join some of that discourse and some of that planning up, so that we're thinking about, people in the course of their whole lives, I suppose, rather than just kind of separating people into adults and children. That's not how communities and families think. So we've got to think about those opportunities as well. But I think, there's some real, really exciting things going forward. And I think we are in a relatively good place, actually, as a city to kind of take advantage of this. I think I would, would urge, Chair, that the Health and Wellbeing Board supports the application for the accelerator. And just to provide some assurance, I've been involved in kind of preparing that, and would be behind it. Thank you.
Thank you. I'm really aware of time, so I think that rather than, because we have a proposal on the table that remains a standing item, I think that's happy. I'm happy to do that, sorry. I'll just bring in Robin before I... very quickly, Robin, because I'm going to move to
very quickly,
the recommendation around the support of...
Some key points that I was going to bring in at the end of the presentation. Just one is from a Health and Wellbeing Board perspective, within the document is a requirement to produce a neighbourhood health plan, which we are assuming is going to be the equivalent of the Health and Wellbeing Strategy. And then the Integrated Care Board, over the entirety of the area, will draw those plans together to develop their own population health improvement plans. So that will be over Derbyshire, Nottinghamshire and Lincolnshire, we're assuming. I just wanted to comment on the two other shifts particularly. So the analog to digital, just that it looks incredibly positive shift for those people who can access digital mechanisms, but there is a real risk behind that. And I know we had the previous report, didn't we, from Health Watch around use of the NHS app. So there are concerns about how inclusive that may be, and there's certainly something that's on our radar to check. And just from the prevention perspective, to note that obesity, alcohol and smoking are all key areas within that, which is good to see. And a move towards the utilisation of pharmacy, particularly around vaccination, which will be of real benefit for us. So I think there's some real opportunities in there around prevention as well.
Thank you. Yeah, I think it's absolutely essential, really, that given that we're moving to an ICB cluster that is so broad and so non-localised, in fact, because there are definitely contradictory tensions within the government's current health reforms. And I think the view is that it's up to us to make it work. It's up to people to make it work. And so the ICB is going to become more remote, in fact. And so I think the obligation on an ICB to acknowledge a neighbourhood health plan and incorporate that into its commissioning plans would be really positive. And so that puts an onus on us to be more systematic, more rigorous, and more committed and serious and earnest about, sincere about anything we actually put forward, rather than just aspirational or critical even. So I think that's a really good, I think it's a good development for the Health and Wellbeing Board, but it's an extra responsibility that we must take very seriously. So I'm really sorry, folks, but I'm really conscious that we're 10 minutes over time. So I think that there's 2 points here. First of all, we're happy, I think we need to come back to this because it's so vast and it's so important that we can. I just need to, we need to think through about the timings of the meetings though, because it may be that we need 3.25 hours, 2.25 hours even. I don't necessarily want to extend the time of the meetings, but we're getting to the point where we can't cover all these items in the time that we have. And we've got a lot of significant health developments happening at the moment. So that's something we need to think about, I think, if people don't mind. And then very quickly, to return to the proposal put forward by Andy Smith, that we actually, because we don't have it currently in the recommendations, because presumably it wasn't available when you submitted the report, Nikki, about supporting this accelerated programme. Is it accelerated programme or accelerated? Sorry? Supporting the application for it, yes. But I'm just wondering if it's called a programme or, I don't know, just pedantic linguistic stuff. But yeah, being in the pilot, It's a pilot, isn't it? It's a pilot run. Would anybody, that's an ask. Does anybody want to ask any questions about that? And are people happy to support the IBCB and its submission of an application for that accelerated programme? Yes, you are. Okay, I see nods around the room. Okay, that's brilliant. So thank you so much for coming in, Nikki. I know it's not necessarily been easy for you today, but thank you. We do appreciate it. We do need to come back to this a bit more, because there are also people out there who don't know anything about this yet. And I think it is so important for everyone, in fact. So we will come back to it. Thank you very much for the presentation. It's quite exciting, pulling out the most positive aspects of the plan. There are other bits that need further work, I'm sure, even by the government. Thank you. So what I'm going to do is I'm just going to end the meeting now. I'm not taking any further items, Alison, if that's okay. We know you've all got a sense of what's on the forward plan. There's loads and loads of updates that we need to take, I can tell you that. And the health protection update, we can note that. We're going to use that as an item for information. So thank you, everybody, for coming, and thanks for your patience and us slightly overrunning. Thanks.